Smokers and the overweight are being denied surgery on the NHS. A Sky News survey questioned the 151 primary care trusts in England. 116 responded. The results reveal more than 10% of healthcare trusts are restricting treatment.
So crippled she can't tidy the house, in so much pain that morphine doesn't help. And yet the NHS won't give Jean Ryan the hip operation she needs. She's been told she's too fat. But with exercise out of the question, she says weight loss is impossible, and despite living on just a pension, she's taken out an £8,000 loan to have her operation done privately abroad. She says it was the cheapest and quickest way to stop the pain.
Can't ever think of me being so far in debt that I know I'm going to be able to get out of it. But I can't see a way around the problem unless I do something myself. It's either that or I end up in a wheelchair.
Our survey shows patients in several areas are being denied operations because they are obese or smoke. 9 NHS primary care trusts have a specific policy to refuse joint replacements to obese patients. 4 won't consider surgery if patients smoke, and another 4 PCTs expect doctors to consider patients' lifestyles before referring them. In all, 6 million patients live in the areas affected.
On July 5th, the new National Health Service starts.
The NHS was created in 1948 to bring treatment to all based on clinical need, but our survey shows those founding principles are being eroded. In the absence of national rules, local NHS bodies are making up their own. They use different cut-offs for body weight, and they restrict different operations. Patients denied treatment in one area may qualify if they lived somewhere else.
These are exceptionally thorny questions. The NHS was set up in 1948 as a national decision with certain parameters. I think those parameters are now blurring, and it's now less certain what the NHS is, and it's probably time to have that discussion again.
Malcolm Taylor has gone 2 weeks without a cigarette. He was told to quit if he wanted surgery on an artery in his leg. After 4 years, he has finally heeded the advice, but his condition is now so bad that he can only walk 100 metres before being overcome by pain.
I said, OK, I'll give up smoking if you'll do me the operation. So I'm now having this scan, and from the scan that will tell them exactly what is wrong.
Some studies show obesity increases the risk of blood loss and infections after surgery. Suffolk PCT is £31 million in debt and says it's common sense to use its money wisely.
We do have a limited resource, as every single primary care trust does, and we need to make sure that we're using that resource to best effect. And quite simply, it's much more sensible for us to use that money where we have a good idea that the treatment's going to work.
The Department of Health insists treatment is delivered according to patients' clinical need, not their lifestyle choice. But that's not Jean Ryan's experience. She feels condemned by the NHS simply for being too fat. Thomas Moore, Sky News.
My understanding is that where primary care trusts are putting in those guidelines are being decided by their doctors. This isn't a matter for managers or indeed government ministers to decide who gets what operation. It's a matter for doctors. It always has been.
But what that means is that there are people around the country, potentially we think 6 million people covered by this, who pay their taxes, pay their national insurance, and aren't going to get their treatment, whereas their neighbour is.
Well, that is absolute nonsense. You're talking... hang on a minute.
No, excuse me,
when
it is not absolute nonsense.
When you talk about 6 million people, you're talking about the people living
yeah,
within those primary care trust areas, most of
and
whom
if you happen to be one of the
need,
unlucky ones,
yes,
one of those 6 million people, your neighbour gets treatment because he doesn't smoke, you don't get treatment because you do.
It is a matter of what the doctors decide is going
It's
to be
not.
right. Well, can I just finish the answer?
But it isn't, is
doctors
it? Because if it's only in certain regions, it's not a medical priority. It's about where you live and how fascistic the doctors are where you happen to live.
I think that's an extraordinary word to use about NHS or indeed any other doctor. Now,
well, let's get this clear. You are here saying it's
made
fine not to give treatment to people because they smoke or because they're overweight. That's what
I
you're
am
saying.
not
That
saying-
is the nanny state, isn't
Well,
it?
if you just let me finish the answer, you know, doctors have always made decisions on clinical grounds about who should get what treatment and who shouldn't. Now, what they're doing in
But
some...
it's not on clinical grounds, Patricia
Well, I'm
Hewitt.
sorry, you're
Why is it
asserting
that
that.
these 13 trusts say, yes, it's on clinical grounds, you can't have the operation, and more than 100 others say, we don't have the same clinical grounds? I mean, what that suggests is that you've got doctors somewhere in the health service who don't know what they're doing.
Primary care trusts are absolutely entitled to get together with their doctors on any particular area of clinical judgment and say, these are the guidelines that we're putting in place for this particular kind of treatment. And when you say people are being denied treatment, when somebody, for instance, is heavily overweight
We've got
or is
a lady,
smoker,
we can show you, who is being denied treatment.
Yes, and I've seen the piece, and obviously that is a matter for her doctor and her consultant. But of course, if somebody is overweight or is smoking, what the NHS will offer anywhere, including in those areas, is treatment to help them with that problem.
You're the one who's,
so that they can then benefit
you're
from
the
other
Labour
treatment.
politician who's always going on about a national health service, how it's free and fair, available to everybody. It's not available to everybody. If you live in those trusts, it's not available to you.
Of course it is. The NHS...
Except it doesn't treat
the
you, so what's the
promise,
point?
It'll treat you with, for instance, help to stop smoking if the doctor's advice is that you shouldn't have the operation until you've stopped smoking. That is a perfectly legitimate clinical decision.
Okay, so you support these doctors. Let's get this clear.
The promise of the NHS...
Even though they're a minority, you
I
support these
doctors making
Right,
clinical
okay.
decisions in the interests of their patients